The oncology care model is foundational in two concepts. One is lowering cost, and the second is increasing the quality of care delivery. So the model itself, obviously is based on that fundamental concept is we need to save a buck. CMS would really like to save some money and is looking at total cost of care in order to do that. So in order to do that, though, you have to increase the level of care delivery that you're actually planning for. So the concepts intermingle. And so when the oncology care model was put forth, the quality metrics that were put in place actually support the lowering of cost in a way. So the three biggest buckets for the OCM measures, the quality metrics, are reducing ED and hospitalization rates, end-of-life care. So that's defined as hospice being initiated 3 or more days prior to death, and patient experience, which they actually determine by patient surveys. And that patient survey has 5 domains: access to care, shared decision making, etc. are all part of the 5 domains that they adjudicate. So when you think about those quality measures, it does obviously have an impact into care delivery, but it also impacts cost. So by keeping patients out of the hospital and in hospice for 3 or more days prior to death, you're actually saving money because you're saving on that hospitalization cost, as well as potential chemo costs associated with that by getting them into hospice earlier. For ED and hospitalizations, it's a quality metric, but it also has a direct impact on cost, because by keeping those patients out of the ED for unnecessary ED visits and subsequent hospitalizations, you're actually lowering cost as well as delivering high quality care. So the concepts may seem separate, but they're actually very much intertwined. Now, Metrics and what AONN has put together in terms of their metrics actually fits very nicely with the quality metrics that the OCM model has put forth. So when you're looking at the laundry list of metrics, and if you are a practice, and the concept behind the Metrics is not to actually implement and adjudicate yourself amongst all of those metrics. That's just basically your toolbox, right? You pick and choose and cherry pick what's going to actually matter and be impactful and be measurable within your practice. So you may want to consider, if you're an OCM practice, to pick those metrics that would coincide with some of those quality metrics and measures that the OCM model has put forth. So there is a lot of value in looking at the Metrics as a support tool and as a resource if you are an oncology care model practice.